In our morning rounds, a treatment offering hope for millions of sleep apnea patients. The disorder causes people to stop breathing when they're asleep. An estimated 22 million Americans suffer from sleep apnea. It puts them at greater risk for diabetes, heart disease, stroke, and memory loss. Patients who are older, overweight, and male are generally most at risk. David Begnaud shows us the new option helping some patients. David, good morning.
Nora, good morning. For those who struggle with sleep apnea, treatments like the CPAP machine can be hard to sleep with. They don't always work, and a lot of people just can't get a full night's sleep with it. But now there's a new FDA-approved device called Inspire, and it's gaining popularity. For some people, it's a last resort. Their life literally depends on it. The Cleveland Clinic named this kind of treatment #2 on its list of top medical innovations for 2018. We met a woman who finally found relief after more than 2 decades of trying to get a good night's rest.
I wasn't breathing. I wasn't getting the correct amount of oxygen. My thought process had gone.
Good job!
Peggy Saravo's memory got so bad, her family thought she had dementia. The 59-year-old was so exhausted, she says she could barely do her job as a nurse.
So people were noticing it, but you were too.
I was too.
You knew something wasn't right.
I knew, not as quickly as they did, but I knew I was in trouble.
Peggy has severe obstructive sleep apnea, where her throat muscles relax, blocking her airway and disrupting her sleep. On average, she stops breathing 53 times an hour. That's nearly once every minute during a night's sleep.
Give me an example of a night.
Up 4 hours, maybe sleep 2. This is the area where I would sleep.
Oxygen machine,
Correct.
CPAP.
Correct.
She tried other
Close it.
treatments.
Take the mask, bring it over my face like this.
She did not find relief from the CPAP machine, a common treatment that delivers constant pressurized air.
The CPAP wasn't getting the job done, so you needed oxygen on top of that.
Exactly. And then that didn't work. That's when they introduced me to Inspire and saved my life.
Inspire is a pacemaker-like device implanted in the chest. It senses when your breathing slows down and sends an electric pulse to the tongue to stimulate it forward, keeping the airway open.
This has been revolutionary. It's been a game changer.
Dr. Mauritz Boone is Peggy's doctor at Thomas Jefferson Memorial Hospital in Philadelphia.
She'd given up. She had memory issues. She was miserable. This is not a benign disease. As I said, this is a killer, and it actually shortens people's lives.
I didn't realize I had it so bad.
A few months after having the Inspire device implanted,
You just need to relax and breathe normally.
Peggy went to a sleep lab to see how it was working.
All right, so listen for me on the intercom, okay? Okay, great. Good night.
They ran tests throughout the night, and early the next morning, Dr. Boone revealed the results.
So before we activated the device, we have all sorts of problems. This is basically your brain saying, I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your oxygen. Nice, stable, flat line, staying around 96, 97%. So this is as good as it gets.
Okay.
And as far as I'm concerned, this is a cure. This is awesome.
A study in the New England Journal of Medicine found that more than 2/3 of patients experience less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest. And now they're finally getting it.
I'm going to show you.
Every night, Peggy turns on the implant right before going to sleep.
What's it like to sleep now?
Great. Turn myself on. I go to sleep. And I sleep. And then I get up and I turn myself off. And I have a normal day like you and everybody else.
Come here, Max. Come here, Doodles.
It doesn't work for everybody, but man, it worked for you.
It sure did. It saved my life.
Love the ball.
Let it go.
Now, Inspire is not for everyone. It's only for moderate to severe cases like Peggy, and like any surgery, there is a risk of infection. For Peggy, she says her memory is back to 100%, and she's sleeping great at night.
And is insurance covering?
So insurance, it's a case-by-case basis. Her doctor had to kind of nudge the insurance company along, but they do.
Well, she must really love her husband after saying on national TV, it sounds like a herd of elephants.
They're sleeping together
Yeah,
again.
that is really great news.
So does she
Good
have to
for your
wear the
marriage, too.
mask when she's got the implant?
No, not anymore. Not anymore.
Wow.
And when she turns it on, she feels nothing. She can just feel it pulsating her tongue forward.
It's like a life-saving device.
Oh, it is.
Yeah.
Absolutely.
Great.